everyone. We're the Yep Crew.
We're normally out and about doing fun sexual health activities around Western Australia.
But today we're here with a serious message.
An outbreak of syphilis has been declared across Western Australia.
Syphilis is an STI or sexually transmitted infection. It is highly contagious and can be transmitted from person to person through oral, vaginal, or anal sex, as well as intimate skin-to-skin contact and kissing.
Skin-to-skin contact is when an infected person comes into contact with an opening or an open wound of an uninfected person.
There are 4 stages of syphilis.
Primary stage. About 3 to 12 weeks after infection, syphilis can cause people to get sores around their genitals or mouths. The sore can be any shape or size, is usually painless, doesn't bleed, and are normally in hard to see places such as up against the cervix, in the throat, or the anus. Even without treatment, the sore can heal and go away within a few weeks, but this does mean that you're still infected. Syphilis bacteria remains in the bloodstream and moves all around the body. But the most dangerous thing about syphilis is that a lot of people don't show symptoms even though they're still infected.
Secondary stage. 2 to 6 months after getting infected, people can develop a rash. This can be on the face, palms, and the soles of the feet. You could also have swollen glands, warts, and lumps. These could be around the genitals, anus, and mouth, and some people even experience hair loss. Again, it is possible that some people won't show any symptoms even though they are infected.
Latent or tertiary stage. If someone has untreated syphilis for 2 years, then it can progress to this stage. The tertiary stage can affect the brain, heart, large blood vessels, skin, bones, and spinal cord. This can lead to permanent physical and intellectual impairments, or even death.
Congenital syphilis. At any stage during their pregnancy, a person can pass on syphilis to their unborn baby. This is called congenital syphilis. Syphilis can affect a baby's vital organs. This can include the liver, brain, spinal cord, and skin. It can also affect bone and muscle development. This can lead to lifelong physical and mental impairments, or even stillbirths, which we have seen in Western Australia.
But it's not all bad news. You can still protect yourself and your partners.
If you're having sex, make sure you practice safe sex and use barrier methods such as the condom, the internal condom, dental dam, or gloves. Using barrier methods during sex is a good way to protect yourself and your partner from syphilis.
Barrier methods will 100% prevent syphilis as you can get it from skin-to-skin contact. So it's best to get a regular STI test. Every 3 months is ideal, but at least go once a year. And yes, that includes if you haven't changed partners. If you are pregnant or planning on getting pregnant, it is essential to test while trying, once a pregnancy is confirmed, and even throughout the pregnancy. If you aren't showing symptoms, syphilis can still be detected by a blood test, so make sure you ask your doctor to include one.
Syphilis is easy to treat if you catch it early. It's just 1 dose of penicillin. If you're allergic to penicillin, your doctor will prescribe something else.
You can take action now. Protect yourself with condoms and dams, and ask your doctor or sexual health clinician about getting a syphilis test.
It's up to all of us to stop the spread of syphilis.